Hi everyone, once again welcome to Public Health Nursing Study Group with ID.Chimedics. My name is ID.Chimedics and we'll be taking you on class 2 today. The community, structures and functions of groups and people in the community for NMCN exams. So get your jotter and pens ready as we begin. Let's have it. So I will be starting briefly with what a community is. A community refers to a group of people that live in the same geographical area. These people share common interests. These people share common value, norms, goals. They interact with each other. And this takes place in a social structure. You know, one thing you must understand that community may be defined by a physical boundary, what you can see, such as neighborhood or village, or more abstract elements. It can be like shared identity, it can be culture, shared culture, belief, and even practices. Now, in public health, the community is viewed as both a target and a resource for health intervention. We target the community because it's like the SI units. After the family, we have the family, SI unit, it moves down, we have a particular point, we have a community, a commune of people, a group of people, group of families, So we view a community as a target and even a resource for health intervention in public health. And it plays a very vital role in promoting health and even preventing diseases, just as we did say in the class 1. And take note that community can be categorized into 3 basic categories or aspects. Number 1 is called the geographical community, and this geographical community has to do with a community based on its location, a defined location, such as a city, a village, a neighborhood. The location is defined. Then we also have a community categorized based on functional and interest based. This community is a community connected by shared interests. It can be such as, let's say, in a school gathering, we have a group of student nurses, a group of health workers, a group of Christians, a group of Muslims, a group of people, religious organization, advocacy group. This group of people that share the same function, they share the same interest. That is what we call functional stroke interest-based community. We also have the third one, which is the last one here, as social and virtual communities. This category has to do with community that is formed through social or online interaction, often without a geographical connection. There's no defined location for that. So this community, brings about people coming together in online space, in your class group, your social media WhatsApp group. These groups are social and virtual community. Just to tell you that community is not only having to do with a geographical area, it can go as far as running vast. So in a quick one, I will look at the next, which is importance of the community in healthcare. Community plays a very important part in healthcare. And number 1 is called health determinants. They play a very pivotal role in health determinants. So you take note that the social, economic, and environmental factors in a community have a major influence on the health of its population. So what they do socially, what they do economically, environmentally, all plays important role. I told us in the last video I made to look into the determinants of health, and I think nobody, just a few or thereabouts. So let's try and ensure we check that out. Number 2 function or importance of the community is community participation. Public health initiative often rely on what we call involvement of the community in decision making. When there is about to there's entrance into the community. First is to involve the community, to bring about community participation, resource mobilization, and even health promotion activities. They have a part to play. Take note that the next one, which is the third function here, is primary health care delivery. Take note that the community is the foundation of primary health care. It's the Ogabata of them all. Take note that it emphasizes healthcare accessibility, equity, and even engagement, community engagement. So in primary health care delivery, community is the foundation of this health care. Take note of that. Okay, we move to the next point, which is the community structures and functions of groups and people in the community, where we'll be looking at the structure of the community, the functions of group of people. There are some certain important people in the community and other members of the community as well. So first we'll look at what is community structure. Community structure is it kind of includes a formal and informal institution, organization, leadership system. All these guide decision-making process in the community. They also guide what we call delivery of services. You don't just come into the community and do whatever you like. You don't just come into the community and you want to carry on with whatsoever you have in mind. You have to pass through some channels. So these are structures that guide the community. Now take note that we also have what we call leadership in the community. I told us that leadership in the community, it could be formal, it could be informal. Now leadership in the community takes this form. In the formal leadership, they are elected or appointed leaders. These are formal leaders, like the local government officials, the religious leaders. They are formal leaders. They are formal leaders that take formal leadership. Next one is the informal leadership. This one are just respected community members who influence decisions through their statute. It can be like some of those youth presidents, some of the youth presidents, for instance. Some of these people influence the community, with their experience, their expertise in some certain areas of the community. Take note that these are informal leadership. Now, under the community structure, we also have what we call the decision making, and decision making here is a collaborative process. It's not a one-man thing. It's not a one-man thing, as I said earlier. Decision making is a collaborative process. It involves various stakeholders, such as the health professionals, the community members, the local authorities, non-governmental organizations, that's the NGO, and they come together to collaborate in order to make decisions. So what are they making decisions for? This process is critical for accessing community health needs. They come together to diagnose the community health need. They set priorities for health intervention. We all come together to allocate resources in order to address these health needs. These are basic parts we need decision making. Also take note that we have what we call community involvement. Community involvement is very important in the community. Active community involvement in decision making, it fosters what we call trust. It brings about the alignment of health program with community needs. Because you are involving them, you will tend to understand where they need your service. It promotes the sustainability of health initiative. These are basic parts that community involvement is important. We run to the next point. Okay, the next point we'll be looking at is called staffing in the primary health care system. Take note that primary health care system is the cornerstone of health care delivery. It's happened majorly in resource limited settings. It ensures universal access to essential health services, and this is guided by what we earlier stated: equity, participation, intersectoral collaboration. All these guide the services delivered in the primary health care system. So what is primary health care staffing? For a well-functioning primary health care system, there must be the provision of multidisciplinary team of healthcare. Healthcare providers, they have to come together. They have to bring about brainstorming to ensure optimal health outcome of community individuals. And who are these healthcare providers? Number one is the doctors, the nurses, the midwives, and even the other healthcare professionals. They provide clinical care. Here they provide clinical care. The next one set of people is the community health extension workers. When you hear CHEWS, 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 the CHEWS are the community health extension workers. We also have under this group, we also have the village health workers, which are the VHWs, the village health workers. This set of people, together with the CHU, act as frontline healthcare workers, delivering health education. They deliver prevention care or preventive care, and even some little medical services. They don't do much though. We also have public health nurses, which are working in collaboration with the community health officers. That is the CHO. They lead health promotion and even disease prevention. They are the leading OGAs when it comes to health promotion and disease prevention. Take note of that. Now, what are the challenges in staffing? Challenges in staffing in this primary health care system include inadequate training. When there is inadequate training, there won't be enough competent staff to take or enact these positions. There is also, when there is lack of resources, is a challenge in staffing. When there is even maldistribution of healthcare workers, it affects efficient delivery of primary healthcare service. When there is no proper, imagine you are sending a CHU to a particular community that is not enough CHU, it's a problem. When you are sending a nurse to a particular community that there is enough, these staffing begin to lack in some other communities that there are enough staffs. Okay. So next I will be looking at collaborative practice of a nurse in relation to other workers within the primary healthcare system. Take note that nurses are essential members of primary healthcare team. Your role is not just I'm a nurse. Your role involves close collaboration with other health workers to ensure comprehensive care for the community. And one of the people or group of medical practitioners you must work with is the doctors. Nurses assist in diagnosing, treating, and managing patients within the primary health care setting. You also will be working with the CHUs and the village health workers, that is community health extension workers and village health workers. What do you do with them? Nurses often supervise and guide these community level workers, ensuring that health education, sanitation, and preventive services are delivered effectively. That is, you must ensure that you supervise them properly. You don't have to be rude to anybody, but you have to ensure that you are professional at every level of supervision. Take note also that you'll be also working or collaborating with the community leaders. What do you do with these community leaders? Nurses liaise with these community leaders, working with these leaders to mobilize community resources and promote participation in health program. I'll look straight to responsibilities of a nurse. Remember, the first one we looked at was your collaborative practice with other health workers. Now is your responsibility. I'll just state 3, then you go and look for the rest. Number 1 is health education. You must ensure that you help educate the individuals, their families, on health promotion, disease prevention, and healthy living. Talk to them about their diet, exercises, sanitation, water, everything balanced should be what? Checkmate during health education. You also carry out care coordination. That is number 2 responsibility. Coordinating care among various health care providers to ensure holistic approach toward patient care. And that is why ID.Chimedics is adding light and life to you, your health and your well-being holistically. As a nurse, you have to approach your patients holistically, give them care holistically. Number 3, which is the last responsibility, is called supervision. What do? You have to oversee the work of the community health workers and supporting these staffs to maintain high standards of care. Okay, lastly, I'll be looking at roles of primary health care workers and agency, where we will be talking about their roles, their challenges, and collaboration with nurses, so that when you are in a particular place, maybe you are opportune to work with a TBA, you know their roles, their challenges, you know how to help in supporting them and assisting as well as supervising them where necessary. Number 1 is the traditional birth attendant. Traditional birth attendant is called them TBAs. TBA, that is with a little s, traditional birth attendants. These group of health workers provide basic maternity care in the community. They provide this care especially in rural areas. They assist with normal deliveries and provide antenatal care, postnatal care using traditional methods. So what are their basic challenges? The TBAs often lack what we call formal training, which can result in complications during childbirth. Take note that many are now actually receiving modern training to improve their maternal outcomes, And how do they collaborate with nurses? The TBA works with nurses closely to refer cases that require higher level care and to also promote safer deliveries. Take note of that. Number two is the village health workers, VHW, as I stated earlier. These play important role in community-based volunteer. They provide, first aid, basic health care, health education, promotion of hygiene and sanitation practices. These are very important parts of the village health workers. They link up with primary health care. They are the first point of contact for many individuals in the rural community, and they play a vital role in disease surveillance. They are the one that survey the environment to ensure that there is no disease, and if there is any disease, they immediately detect it. They report to the formal facility about any findings discovered. The number 3 here is community extension workers. Quickly, we have the senior community extension workers and the junior community extension workers. These are the J2 and the S2. I'll start with the S2, which is senior community extension workers. They provide primary care services, including immunization, family planning, maternal and child health services. These are the duties of the S2, while the J2 includes supporting these senior community health extension workers in promoting the health and preventing diseases at the community level. How do they collaborate with the nurse? They do this working under supervision of nurses and physicians to implement public health program, as well as ensuring continuity of care. The number 4 here is called the community health officers. These are the CHOs. These CHO play an important role in overseeing that there is implementation of primary health care services. They supervise the CHO, which is the community extension workers, and ensure that public health goals are met. They also monitor health trends. They bring about initiation of health education campaign. They go for this school to carry out the school health programs. They collaborate with nurses to ensure that the plans as well as execution of these programs concerning the health of individual are properly done. They also assess community health needs in collaboration with the nurses. I'll run to the 5th one, which is community midwives. Community midwives are also health workers with vital role in the community. They provide maternal health services. Very important. Take note, these maternal health services are the antenatal care, postnatal care delivery. They promote safe motherhood and family planning. They carry out this family planning within the community, ensure there is proper counseling before any services is offered. Their collaboration, they work closely with public health nurses. These community midwives work closely with public health nurses to ensure that there is safe and healthy delivery. They also work with community physician. I move to the 6th one quickly. The 6th one is community nurses. What do? They deliver a wide range of services at the community level. Community nurses. I think NACON is now offering opportunity for community nursing, so you can apply. Take note, they deliver a wide range of services at the community level, from administering of immunization to managing chronic diseases. They play a very important role or pivotal role in health promotion and disease prevention. Of course, that is the basic part or root of primary health care. The public health role here, what do they do in public health role? The community nurses are at the front line of implementing national health policies. Yes, they ensure the health of the population through outreaches and campaigns. They ensure that policies are enacted and obeyed. Take notes that public health nurses are the servant health workers. They are very important, and if you are a public health nurse, aspiring public health nurse, you can smile on your role, which I'm about to state. Take note that the role of the public health nurse is focused on the health of the entire population rather than individual care. You don't just carry out individual health care. I told you that from the name public health, you need to understand that it has to do with a population. What do you do as a public health nurse? You plan, you implement, you evaluate the community health program. All these are aimed at disease prevention and health promotion, which we have been talking about, and is an exam question. Almost all the duties you carry out as a public nurse is aimed at what? Disease prevention and health promotion. What are your responsibilities? Okay, public health nurse work at a large-scale health initiative, such as in vaccination drives, health education campaign, and even response to health emergency. They carry out these services in a wide range. I'll go to the second to the last one, which is the community physicians. These are doctors that are trained in public health. They help design policies and programs to improve the public health, or you call it population health. They are the one that accesses epidemiological data. They look at those things that are surveyed, what should be done and what not to be done. They address health disparities and work with health workers to ensure there is implementation of public health intervention. Take note of that. I'll run to the last one, which is the ninth one, and this ninth one is voluntary as well as non-governmental agencies. This is a very important agency when it comes to the community health. Take note that their role is to, that's the NGO, is also called NGOs. They complement government health services by providing additional resources, expertise, and even services in areas like maternal health, child health, and even what we call infectious diseases. These are like voluntary workers. They do this. I pray God blesses them. Yes, they do this, and they assist the government, complement the government with these health services. Now, with their collaboration, they often partner with the community health workers, the nurses, even the government and the agencies to implement public health programs. They provide resources, finance, funding. They do a whole lot, and I pray God blesses them. Take note that is where we end our class. But before we end, I will give you a little tip on exams. What you need to understand: you need to master the definitions, be clear about the definition of what a community is, what is PHC, and the roles of various health workers. Ensure that you understand the relationship of how a nurse collaborates with other health workers, and also understand the roles of the workers, knowing the specific roles and the responsibilities of each of these workers and how they contribute to the community health. So in summary, don't forget that the community is a group of people sharing common interests, values, the same geography, influencing health through social, economic, and environmental factors. Take notes and don't forget that the community leadership can be formal or informal, and it plays a critical role in decision making and also plays an important role in public health intervention. Also take note that the primary health care system is staffed by a multidisciplinary team, and this includes nurses, doctors, community health extension workers, which I told you will consist of the senior and the junior. We also have what we call the village health workers. Take note of the TBA. All these come together, collaborate to deliver essential health services. Don't also forget that nurses in particular have key responsibilities such as providing health education, supervising other health workers, and coordinating care. Also note that various primary health care workers like the traditional birth attendants, the CHU, the public health nurses play distinct role in promoting health, preventing disease, and addressing community health needs. And lastly, don't forget that non-governmental organizations and community physicians, they provide additional support and resources to strengthen healthcare delivery in the community, at the community level. I think this is where we'll be stopping class 2. Don't forget to get your material for MCQ under the community and ensure that you study ahead for class 3. I will be dropping class 3 soon. If this has helped you, click on the subscribe button and also ensure that you like, comment, ask questions, share this video. God bless you all. See you in class 3.